Hey guys, we're back. It's Dr. Ryan Rehl, Dr. Dan Hurley. This is From the Top. We're out here on Camelback Mountain. We got a good hike this morning. And because we're in the midst of a pandemic, we want to talk about masks. So, Dan.
So, masks have been on everybody's mind and on their faces for the last month or two or more. And so we wanted to go through our take on them and our experience. We're not experts in masks. Seems like there's a lot of experts everywhere today. But we do know a little bit about the history and have, a combined 40 years of experience of wearing masks. So historically, masks have been around for over 100 years. They've been around back with the shamans and the medicine men. And then in about 1900s, early 1900s, people started wearing them in the medical field. At that time, it was primarily source control. We have been through masks in a pandemic before. Masks were mandated in the 1918 flu in San Francisco and multiple other cities. We had the same consternation we have now about constitutional rights, legality, versus is it just what's best for everyone. So we got through it then, we'll get through it now, but today we wanted to take you through some of the science and some of the practicality of why we think that at this point in time, it is more likely than not that they're helping you out, getting about your life. Ryan?
Okay, so masks during a pandemic, especially with a respiratory virus, are important. And, we understand that some people feel as though they're having their rights violated by mask mandates, but what it comes down to is masks, we do think they help, and they help diminish the chance of infection. So what it comes down to, if you're coming to see me in my ENT clinic, I want you to wear a mask when you enter the building and when you're in the waiting room. And the reason why is because we think they work to decrease the spread of the virus. And there's anecdotal evidence that supports that. And now we have some data in the literature that's out there, including a meta-analysis that tells us that masks work to help prevent spread of disease during a pandemic. So we'll start with anecdotal evidence and work our way to the meta-analysis. So anecdotally, we can tell you that, there are some interesting case studies out there. One that's interesting to me is a Missouri case study of two hairstylists. So this is during the current COVID-19 pandemic. We had two hairstylists that were infected with the SARS-CoV-2, so they actually had COVID-19. And despite having respiratory symptoms, they kept working, so they kept cutting hair. And between the two of them, they had, I believe, 139 clients that they cut hair for while they were symptomatic with the virus. What they did correctly, though, is they were wearing a mask. So they were working in a salon where they had to wear a mask. Interestingly, all 139 of those people that they cut hair for did not contract the virus.
So that's a good example of really what we're talking about when we're masking everyone in the community. Is it's all about source control. So the biggest challenge that we believe we're up against is that asymptomatic people can have the virus and be spreading it before they become symptomatic. And so the masks are preventing me from giving something to you when I don't even know I have it yet. And that's also why we advocate for, in the absence of the availability of something like a surgical mask, a cloth mask. It's keeping what I have when I cough out of my mouth from spreading around the environment. And of course, that's not a randomized controlled study, but there are studies, not with COVID-2, that will show you that even a cloth mask will diminish about 50% of the particles coming out. Now 50% is not 100, but 50% is better than nothing. And with any virus, there's a viral load that's required. So if you can diminish the amount that you're exposed to, the probability of infection drops. So that's a great kind of case study. There's a good meta-analysis out of the Lancet that deals with primarily surgical masks, and Ryan can take us through that one.
Yeah, well, I also think with that Missouri case study that 67 or 69 of the exposed customers at the salon agreed to be tested, and they all tested negative. So interesting. So there's anecdotal observations help us form theory. So the rational progression there is, well, maybe the masks prevented those customers from getting this highly contagious SARS-CoV-2 virus. So, and then working into the literature. So you mentioned the Lancet study. So the Lancet study, which was published last month in the Lancet, very well-respected, established medical journal, to say the least, looked at all of the studies that studied infection with coronaviruses. So they looked at SARS, so severe acute respiratory syndrome, that, you know, we were familiar with the previous pandemic of SARS, MERS, Middle East Respiratory Syndrome, and SARS-CoV-2, which is the cause of the current COVID-19 pandemic. Those are all coronaviruses. So they looked at all the studies on coronaviruses and whether or not masks helped in those studies to decrease the risk of transmission. And what they found was masks seemed to work. Now, there were no randomized controlled trials in that meta-analysis of 25,000 study subjects, but all the observational studies, they did show that if a patient or a healthcare worker or a subject in the community is wearing a mask and is exposed to someone with, you know, COVID-19 or SARS or MERS, they have a 3% chance of contracting the infection.
With a mask.
With a mask. When they weren't wearing a mask, so subjects that were not masked but were exposed to someone infected, that risk of infection was 17%. So with this meta-analysis, what the authors concluded is that it seems that masks help, and if you're not wearing a mask and you're exposed to somebody with it, there's a 17% chance you're going to get infected with coronavirus, and if you're wearing a mask, there's a 3% chance.
So there's a, basically a 4 to 5 fold decrease. Now, nothing's perfect, but in the setting of widespread community spread, that may be valuable, which brings us to our next point, which is masks help us continue about our lives. And we experienced this working in healthcare, where initially when this started, we didn't know what the right thing was. Nobody did. And so we were all about preserving supplies. But if you don't have a mask on and you happen to be exposed and you have a high-risk exposure, you now have to take yourself out of your life and sit aside to see whether or not you've contracted the virus. And whereas if both parties have masks, or even one of them, and you find out you've had a high-risk exposure, which is less than 6 feet for more than 15 minutes, now all of a sudden that takes it into, you just get to monitor for symptoms. You don't have to be potentially quarantined. And so from my standpoint in the current environment, I'd say when I'm not in my bubble of the people that I socialize with on a regular basis, which of course we've diminished during this time, I'm going to wear a mask because it makes it less likely that I'm going to have to sit home, especially when I'm going to be closer than 6 feet for more than 15 minutes with anyone. So, I think that's most of what we wanted to communicate today. We believe that you have a 4-fold decrease if you have a mask. We believe that you'll be able to get about your life with a mask on. But we also recognize that masks have a price. They have a cost of making them or procuring them. Of course, we are humans, so we're social beings. Interacting is important, seeing people's faces and smiling. And we're, of course, acutely aware because we deal with people who can't hear. And if you can't hear, you're really relying on seeing people's lips. So I think that while right now we have masks, the next challenge for our leadership in the medical community is to start to try and, give us parameters of when it will be safe to stop. And we don't know that yet, but we do know that based in history, this won't last forever, and they got through it before, and we'll get through it now.
So Dan, the literature is telling us masks help. We didn't even mention that Massachusetts, that MGB study that showed that healthcare workers, they decreased their rate of infection in the hospital by wearing masks. But what about the people, you read stories online and social media, what about people that say, but masks can prevent me from breathing well, masks drop my oxygen level, masks cause hypercapnia, drive up my CO2, masks are unhealthy because they they can ultimately lead to suppression or damage of my immune system. What would you say to folks that
I think that
espouse that masks are bad because of those things?
I mean, masks are a pain. I completely agree with that. But I don't think there's data that supports that masks are harmful. For years, both of us have worn masks for hours on end in the operating room. Certainly, there are guidelines, which I don't have on the top of my head. If you're less than 2, or if you have a respiratory disease, you don't need to wear a mask.
Yeah, less than
but
2.
There is no data other than anecdotal that would, and really anecdotal, meaning I don't like a mask, I think it was bad for me, that would support that it drops your oxygen or that increases your carbon dioxide to unsafe levels.
Well, so we talked about this earlier on the way up. There's a study in 2011 in the journal Respiratory Therapy, and they did actually put people on a treadmill for 45 minutes with N95 masks on, and they compared different types of N95s, the ones with the exhalation valve versus the ones without. But what they found was that basically when they put you on a treadmill at 1.7 and then 2.5 miles per hour speed, that your baseline oxygen saturation was 98.5%, and it dropped to about a percentage point, which by p-value with the study is clinically significant, statistically significant I should say, but you and I both know that it's not clinically significant, and those people weren't symptomatic. So what we know is, look, even walking on a treadmill for 45 minutes with an N95, which is a more restrictive mask than a cloth mask or even a standard procedure mask, it's not going to drop your oxygen level.
Right.
And then anecdotally speaking, look, surgeons, we've been wearing masks in the OR for 100 years, okay, for source control. We wear masks to protect the patient and the surgical field from our respiratory droplets coming out of our nose and mouth. And
which is actually the real reason why masks are being recommended for this. I don't know if that gets as much play, but people aren't protecting themselves by having a mask on. Masks in the community are about source control. So, but anyway.
And clearly, I mean, surgeons are not getting hypoxic and hypercapnic and confused at the end of a surgical procedure.
It's arguable.
So we're familiar with masks. So and just even an N95, I was in a long case on last Thursday, 11 hours in an N95 mask, and it's just not an issue. The immune system thing, again, your immune system's not going to get weaker because you're wearing a mask. I think the hypothesis there is that, well, I'm not inhaling infectious particles that will keep my immune system honed and proactive. Look, you're still going to get plenty of microbes through food, and look, cloth masks and procedure masks don't filter out all microbes. But anyway, I just don't think that there's any sound argument there that masks are inherently bad for you, unless of course you have a legitimate respiratory condition and you're at baseline short of breath.
So anyway, in summary, for the time being, we think they help for source control. We believe that it's not going to last forever, and hopefully you enjoyed this, and we'll catch you next time from the top.
See you next time, guys.